Okay, so welcome everyone. Dr. Linden, we're going to continue with some superficial anatomy. We'll talk about some reference terminology. We'll talk about body regions. We'll talk about the quadrants, the stomach, the quadrants, as well as the non-abdominal pelvic regions. We'll go over some really important key reference terminology as well. So let's look at the reference terminology first. This is really important to understand. You'll see it on your Connect quizzes. You'll also see these terms move forward when we talk about muscles, and arteries, veins, and nerves. So getting the foundational terminology is really, really important. So here in the cephalic region, or the head, right? Cephalic, my wife is from an island in Greece called Cephalonia. It means the head Greek island, or Kephallonia. In the brain, there's a part of the brain called encephalon. There's the word cephalic. And there's a cranial portion, and there's a facial portion. This is the skull portion, and then there's a facial portion. This part of the skull is called the frontal portion. We will learn a muscle called the frontalis muscle. We'll learn a bone called the frontal bone. Here is the nasal, or the nose. There's a nasal bone. There's a nasal septum. The eye, this is the ocular region, or the orbital region. The ear is called otic. The cheek is called buccal. There's a muscle called the buccinator that we'll talk about. Buccinator. The chin is called mental. There's two holes here. We do osteology. It's called the mental foramen. Foramen means hole. So mental refers to the chin. There's a muscle also called the mentalis muscle. The mouth is called oral, oris. There is a muscle called the orbicularis oris, orbicularis oris. The neck is called cervical. Cervical, there's 10 cervical vertebrae. The chest is called the thorax, or thoracic region. You have 12 thoracic vertebrae. Then the breast is mammary. Both male and female have mammary ducts and breast tissue. It is just that hormone testosterone at the time of puberty deactivates the growth of the mammary ducts, and estrogen increases the production of the mammary ducts. Okay, so hormone is really important for maturation and sexual development. The stomach is called the abdominal region. The belly button is called the umbilical. All three of these, the thorax, the mammary, abdominal, umbilical, this is known as trunk. So when we do muscles, we talk about trunk muscles. The armpit is called the axillary region. Arm is the brachium. And in front of the elbow, the antecubital region. Axillary is important because you'll hear the axillary artery, axillary vein, axillary lymph nodes. Okay. The clavicle. Here, sternocleidomastoid muscle, going from sternum, clavicle, sternocleido, and then to the mastoid process. So it's SCM, sternocleidomastoid muscle. So I pop up on the exam again. This is like drag and drop. So here's frontal lobe, here's your orbital, here's nasal, here's mental, buccal, ear is otic. Here is the anterior cervical triangle, which is boundaried by the sternocleidomastoid, and then lateral to the SCM, outside of it, is the lateral cervical triangle. See the SCM, the trapezius, and then the clavicle help to make the lateral triangle. Then we look at the lower forearm, the antebrachium. The wrist is called the carpal syndromes, bones of the wrist, carpals. The palm, palmar region. The fingers are called phalanges. Phalanges. The toes are also called phalanges. The thumb is known as pollex or pollicus. Pollex or pollicus. If we look at the foot, the toes are also called phalanges. The great toe is hallux. Hallux or hallicus. Hallux or hallicus. So the thumb is pollex, the toe is hallux. Just remember PP, right palm, pollicus. Think H, hallicus, hallux, with heel for the foot. The foundation of the foot is pedal or pedal foundation. Think of pedal, like pedaling a bike. The thigh region, this is called the femoral region because that's the femur bone, longest bone in the body. You have the pubic region, and then you have the inguinal region. Here's the inguinal ligament here. The kneecap is called the patella, and the leg is called crural. The wrist, carpals, and the foot you have tarsal bones. There's carpal tunnel syndrome, and believe it or not, also tarsal tunnel syndrome. There is the cephalic region, which is the head. The neck is the cervical. The highest point of the shoulder is the acromial region. The back, sometimes called dorsal. The front is called ventral. Ventral is front, dorsal is back. Sometimes dorsal and posterior are interchangeable terms, and ventral anterior are interchangeable terms. Is your upper limb or upper extremity, and the back of the elbow is called the olecranon process. That's the part of the elbow that you lean on. When we look at the rump, this is the gluteal region. When we cover the muscles of the tush, there's the gluteus maximus, the gluteus medius, and the gluteus minimus. So gluteal is this part here. Behind the knee, there's a depression back here called the popliteal region. That's the popliteal. Remember, the front of the knee is called patella, behind the knee, popliteal. Calf is called scrotal, the heel, calcaneal, and the bottom of the foot is the plantar surface. Palmar surface of the hand is your palm. The plantar surface is when you plant on the ground, plantar surface. So here are some directional terms. These are all opposites. So superior and inferior are opposites, anterior and posterior are opposites, and medial and lateral are opposites. So let me show you what these look like on a picture. Proximal and distal are opposites, superficial and deep are opposites, and contralateral and ipsilateral are opposites. So here, when we look at a person as a whole, when we move up to the top, we're moving superiorly. When we're moving down to the bottom, we're moving inferiorly. However, when we're talking about an extremity, like an upper or lower extremity, when we're moving furthest away, we're moving distally. When we're moving closer to the trunk or to the beginning, we're moving proximally. When we're moving down the femur, down to the toes, we're moving distally. When we're moving upwards to the beginning of the femur, proximal. So proximal and distal, they're opposites. Superior and inferior are opposites. Medial and lateral are opposites. When you're moving closer to midline, to the center of the body, you're moving medially. When you're moving away from midline, you're moving laterally. So the thumb is the most lateral finger, or digit 1, digit 2, 3, 4, digit 5 is the most medial. Okay. If I were to tell you that this young lady has right shoulder pain with ipsilateral wrist pain, it means that her right shoulder and right wrist hurt. If I say this young lady has right shoulder pain but contralateral wrist pain, it means it's the opposite wrist. Superficial and deep. Superficial is everything we see here on the surface. Deep is when you move deeper into the body. So the epidermis of the skin is superficial. If we move deeper, we're getting to the dermis. If we go deeper than that, hypodermis or subcutaneous. Here is anterior, when you're moving to the back, posterior. Anterior, posterior, or ventral and dorsal. Just like a dorsal fin of a dolphin. The dorsal fin is on the back side. Okay? And again, superior and inferior. Where do we use proximal and distal? When we're talking about the extremity. When you're talking about head to tail, now it's cranial to caudal. Okay? Or cephalic and caudal, both the same. Caudal means tail. Proximal, distal. We're talking about the upper extremity, proximal to distal. Okay, let's look at the 4 quadrants. This is when we divide the body into 4, a right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Please understand that we're talking about anatomical position. I understand that this is your reading left and this is your reading right. However, we're talking about the patient or the individual in anatomical position. This is their right shoulder. This is the right upper quadrant. This is their left shoulder. This is their left upper quadrant. Right lower and left lower. This shows up in a patient's file all the time. Patient comes into my office with right lower quadrant pain. They were stooped over. They were holding the right lower quadrant. They looked a little pale. They had a little fever. They felt nauseous. What could it be? Well, let's look at the anatomy. What do we have in the right lower quadrant? Maybe it's this. Maybe it's the vermiform appendix. Could be an appendicitis. Okay? Or right upper quadrant pain. Maybe it's the gallbladder or the liver that's inflamed. Okay? So knowing where the body parts are help you understand why people may experience sensitivity in certain quadrants. Now we talk about the 9 regions, the abdominal pelvic regions. This is when we divide the body into 9 regions. Here it was 4 quadrants. So we could start at the belly button. That's the umbilical region. The term epi means above. Hypo means below. So here is epigastric, above the stomach. Here it's hypogastric, below the stomach, also known as the pubic region. This is your left lumbar and right lumbar, sometimes called the left flank and right flank. Left inguinal, right inguinal. Okay, so those are the 9 regions. And then again, this has shown up on past Connect quizzes where, again, it was simply drag and drop. So umbilical is the center, epigastric is above, hypogastric below or pubic. Here's the left lumbar or left flank, right lumbar, right flank, right inguinal, left inguinal. Then we're left with the hypochondriacs. The hypochondriac means just below the ribs. Here's the left hypochondriac and the right hypochondriac. Chondria is cartilage of the ribs. That's how it gets its name. And again, here are the organs that overlap with some of the quadrants, but we're looking at 9 regions. Most people, most healthcare professionals use the quadrants over the regions, but it is still taught and important to know both. Okay, I am going to pause it here, and then I'm going to start the different planes. So let me just pause here.